When most of us are experiencing lockdown these days, it is the healthcare workers being on the front line, putting their lives at risk in the fight against COVID-19. Today for this episode, I am joined by one such Tibetan doctor who has been working in the COVID-19 Assessment Center and as a frontline staff. She has been practicing medicine for over 15 years and currently works as an internal medicine doctor in the Greater Toronto area. She is Dr Tenzing Calden Sharngoe. Tashdile Dr Calden La, and welcome to our show.
Tashdile Sakina.
Dr Calden La, before we begin, I would like to thank you and all the health workers around the world for the effort that you all have been putting in during this pandemic.
Thank you. It's my pleasure to be here.
Dr Calden La, can you please tell us a little bit about yourself?
I grew up in Gangtok, Sikkim and went to medical school in Lady Hardinge in New Delhi. Then I moved to the US and did my internal medicine residency and infectious disease fellowship. And about 6 years ago, I moved to Canada and now work as a hospitalist, practicing general internal medicine.
You are one of the frontline workers working in a hospital in Canada. You have been dealing with different situations with many COVID-19 patients and must have observed a lot in the past few months. Tell us about your experience in the hospital. How is it like?
It's actually been a rough few months. I don't think any of us expected to be in this situation. Levels of government have actually done a pretty good job of putting in social distancing rules, especially here in Canada. And as soon as we started noticing cases here in Canada, our hospital system established put certain things in place, basically. What we did was we set up a special COVID unit, had staff working there exclusively so that we don't have any cross-contamination. Also, there was a COVID assessment center set up, which was basically to make phone calls to patients who are at home, making sure that they were doing okay, and also to assess if they needed to come to the hospital to be admitted. So those were the things that were set up. But once we started seeing patients in the hospital, it was a different feeling. In the beginning, it was we were quite anxious, not knowing if we were equipped for it, how bad it was going to be, because some of the other countries around the world had been hit quite bad. But as we started seeing patients and actually interacting with them, some of them needed higher levels of care, ICU kind of care. Some of them were okay on the medical wards. But I think 2 to 3 months down, we're now at a state where we're actually doing better. We have people who have recovered and they've been able to go home. And I think what was inspiring was we recently had an 80-something-year-old man who was in the hospital for over a month, and he was able to go home. So that was, overall, it's been a roller coaster ride, and we're glad to be in a state where things are in the downtrend.
Comparing this coronavirus with the previous disease, SARS, that happened in 2003, both of them have similar symptoms such as fever, cough, and difficulty in breathing. Also, there is no cure for SARS except for the supportive treatment like that of COVID-19. We know that there are no experts in the world for COVID-19 yet, but do you think that there is a possibility of coming up with a vaccine for this growing pandemic? How long do you think that we have to deal with this?
Okay, to answer your first question, there are multiple scientists working all over the world to find a vaccine that works for COVID-19, right? But the process of making a vaccine is long because it's got multiple steps. First, they have to try it on lab animals and make sure that the vaccine actually works. Then they have to make sure that there are no major side effects, because then otherwise it would defeat the purpose of actually having a vaccine. Then they have to try it on humans to make sure that the same results are replicated on humans. Some of these steps cannot be expedited, and that's why it's a long process. So yes, there is a vaccine that's been worked on by different groups of scientists, but it's kind of difficult to say when exactly this is coming. I do think it's not anytime soon, though. There's no end to it unless we figure out how to break the chain of transmission, and that's where social distancing comes in. The virus is transmitted from person to person by either contact or droplet, right? Say if I was sick and I were to cough, say on my hands, right? And then I touched the table and you were right there and came and touched the table and you touched your face with your hands. That's how the virus transmits. Hence, people are in countries are in lockdown and social distancing, and you're trying to break that chain of transmission from person to person. And when we go back to even close to what was normal before, right, we are going to see a rise in the number of cases because that's how the virus transmits. So it's very it's trying to find that balance between what would be a new normal, but keeping in mind that we're going to have an increase in number of cases, but trying to flatten the curve, as they say, so I don't think it's going to life as we knew before COVID-19 era is going to come back in at least a year, I'd say.
So the best thing that we can do now is to take all the possible precautions.
Absolutely. Yes, right. There's a reason, countries are in lockdown and in social distancing, freezing the economy, but it's what's required to prevent further death and more people being sick.
While many of the health workers and professionals continue to work since the time the coronavirus outbreak started creating panic everywhere, there are many others who had to give up their work for the safety of their families and themselves. What has inspired you to continue working despite the situation being critical?
We're all in this together as a society, trying to fight this major crisis. My role is not any different than anybody else. Whether it's individuals who are staying home or essential workers who are ensuring we have our basic necessities, or people like you, Sakina, who in the media, who are making sure that the public is informed about this pandemic that we're in. Each one has a role to play, and I'm doing my part just like everybody else is. It is a difficult time for all of us, and once this is all over and it's safe to travel, I look forward to visiting my family and cherishing those moments.
While working in the hospital and dealing with many COVID-19 patients, you also have to spend time with your family and friends. How do you manage to keep your family and friends safe with whom you have regular interaction?
Interaction with friends and family has changed drastically since being in this pandemic state. My husband is an essential worker, so he goes out to work as well. Both of us try our best to make sure we take precautions when we leave work and come back home. We've done our meetups with friends and family in the driveways, where we stand in somebody's driveway, have a conversation, but maintain that distance so we're not transmitting the virus if we are carrying it.
Dr. Calden, how have your family been reacting about you working as a frontliner for this incurable and contagious disease?
It is a scary thought for them, right? Most of my family live in Sikkim still, and when I talk to them on the phone, They're worried for me. They hear about all the horror stories of lack of PPE and personal protective equipment. The doctors getting it and people dying from it. But I reassure them that at least in the hospital that I work at, we have adequate PPE. We are trying to conserve it as much as possible. But we have adequate PPE. We take all the precautions we can. Make sure we use different set of clothes at work. Come home with a different set of clothes. Wash my hands multiple times a day till my hands are dry. Wipe all our the phones, badges, things like that before we come home. But they do know this. It comes with the job, so they get reassured.
Dr. Calden, is there anything that you want to tell our viewers that you think is important for them to know during this hour of crisis?
Yes, I was recently talking to my family members here, and I was showing them how to wear a mask because they're not in the medical field, and now we're using masks even in public. So they thought it was a good idea for me to show general people who are not in the medical field how to use a mask and how to wear gloves, without contaminating your hands. So I think I would like to show that. So before you wear your mask or gloves, you do want to wash your hands with soap and water, right? Or you can use your hand sanitizer and make sure you rub it properly in your hands. And you have to make sure that if you're doing the hand sanitizer, you have to make sure that it's dry before you touch anything else or use gloves, right? All right, so this is a medical quality mask. It's got ear loops and there's a little metal strip on top. So the metal strip part is what goes on top, not the bottom. Okay, you want to make sure you don't touch the inside of the mask or the outside of the mask with your hands. Always hold on to the mask with the ear loops or ties if it's a homemade mask, right? You take it and put it over your face, loop the loops around the ear, and then you want to make sure that the top of the mask is on the bridge of your nose and clip the metal piece onto the bridge of your nose properly. And the lower part of the mask, you got to tuck it under your chin, so that way your nose and your mouth are both covered. And in the process, you have to make sure you don't touch the front of the mask because that's the part that is contaminated. Okay, you go do your thing, and the way you remove your mask is the same way. You pull it from behind your ear, from the loops, and you put it on a clean piece of paper. You can reuse these masks as long as they're not wet or they're not obviously soiled, right? So you can save it for the next day or the next time you go out. Put it in a clean piece of paper like this and make sure you fold it over and you can save it, right? The next thing I want to show you is how to wear and take off gloves properly. You have to make sure that the gloves are your size. If the glove is small, it's going to rip, right? If the gloves are too big for your hands, then it's going to come off. It's not going to stay on your hands, and then there's a risk of contaminating your hands. All right. Wearing the gloves is the easy part, right? You wash your hands or sanitize your hands. Put your gloves on. Right, and do your thing. The important part is once you've used your gloves and you want to remove it, because now your gloves are dirty and you're trying not to make your hands dirty in the process. So you pull the first glove inside out, right? and hold it with the gloved finger. Then you take your finger and put it in the inside of the glove and pull it out. Right, so then you put it in the trash. That's it.
Thank you, Dr. Calden for this informative knowledge, and thank you for showing us the correct way of wearing our mask and gloves. Thank you for coming to our show.
Thank you, and it has been a pleasure. Stay safe.
Thank you.